A viral video of a woman in labor who is discharged from the Indiana hospital while in labor is shining a light on a much bigger problem regarding black maternal health.
We have a lot to talk about today, y'all. Rooted in Progress starts right now. All right.
I was met with really stern faces, like no welcoming faces, as I usually would get when I go to, a hospital or a place of care. I was 10 minutes apart with my contractions. By the time I got upstairs, it was about 8 minutes apart.
My daughter's in active labor.
I was in excruciating pain. She seen me in pain and agony. No empathy. She didn't show any care as a usual nurse would.
My, lots to discuss from that viral video of Mercedes Wells speaking, as well as her husband undergoing a situation that I don't think anybody would want to be in. Thanks for joining us for Rooted in Progress, y'all. It's your host, Deanne King, for Terrence Middlebrooks. We have so much to dive into today, Terrence.
Yeah, we do. And man, this video has been going around social media over the past several days, and it's been a very hot topic amongst mothers, amongst the black community, amongst social media in general.
Yeah, it's tough to watch. It's tough to watch. It's tough to digest, right? Because you feel not only for Mercedes, her child, her husband, her family, but then you also are like, could that be me?
Yeah.
Right. And so this is definitely something that we are going to dive into today. We have a large panel today on Rooted in Progress. We are joined by none other than Mercedes and Leon Wells and their new little bundle of joy, Alina. Thank you all so much for joining us, as well as their attorney, Cannon Lambert. Hey, y'all.
Hi, thank you for having us.
Absolutely. And then here in the Rooted in Progress Stream Center, we have Yamel Belen, who is a local registered nurse, as well as a doula, because she's going to speak to the statistics, what faces and what we deal with when it comes to black maternal health. So we appreciate you coming in and bringing your expertise to this conversation. I know we're going to start with some of those heavy questions. Mercedes, Leon, we're going to start with y'all. And I know it's a question that I think y'all probably get a lot. We all do as humans. And it's just, how are you? But I really want to know, how are y'all doing today?
Overwhelmed with exhaustion, honestly. Because just, the emotional roller coaster that you go through after such a traumatic event, it comes in waves, and people think like,
I'm trying to stay strong because it was just a hard experience, like feeling less than, and the way they made us feel as human beings wasn't right.
My goodness. Walk us through how we got here and what happened.
Well, when we got to the hospital, they put us in a triage room. The nurse came and she checked me. I was going through these contractions walking through the door, so I was already in a lot of pain. My contractions went from 8 minutes, 10 minutes, 8 minutes, really fast, down to 6 minutes, 5 minutes, really fast. The more I walked the hallways, went down to 1 minute.
Wow.
The nurse checked me and said I was 3 centimeters.
Wow.
She said that I wasn't dilating quick enough. I had to be discharged after 6 hours of going through my labor.
Now, was that policy? Like, where did she get this number from that you had to be discharged at that time?
She didn't say that it was policy. She just said that if the doctor says that I have to be discharged, then that's the policy. But the doctor never came to see me.
The doctor never saw you?
The doctor never showed her face. I never seen her. She never came into the room. I never spoke to a doctor. I only spoke to the nurse on call.
Now,
Wow.
now you guys are not new to this. I mean, this is you walked this rodeo before, so you know when that baby is about to come out. I mean, was there any type of urgency in your voice? The fact that I need to be seen now.
Yes. So she, she was she after she checked me, she's just like, well, if you're not further along, we're going to, discharge you. So in the beginning, she had the energy of releasing me from the hospital. And I told her, I'm about to have this baby right now. I'm about to have this baby. I'm like, my water just broke in the bathroom.
Wow.
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 The baby's coming.
Was this
I
your
cannot leave.
was this your normal hospital? Like, is this where your OB was working and where you had
No,
planned to have Alina?
no, we were coming from a trip. We were on the road, and we were coming through the area. So we had to go there. I had been there before. The Franciscan, I've been to Franciscan before with my other baby. She's 2.5 now. So
Wow.
they knew me. They
Oh,
had my information in the
Okay.
system.
okay. And Leon, share at this moment from your vantage point, you're witnessing your wife go through this. How is that taking a toll on you in the moment while everything's happening?
Um, my nature, I'm a protector. I'm a provider. That's my nature. And to like see these videos, to see the way my wife was at that situation at that time, by God's grace, I was able to hold myself. Um, I couldn't. It was hard for me to kind of. When I say my wife let out a cry that I never heard anybody do, let alone my wife. Um, I grabbed her and held her and say, "We are children of God. God's gonna get us through this." And she got in the wheelchair, and that's the video that you guys saw after that. But
Go ahead, Tim.
to be, the two nurses that took us down was not even our nurse. Our nurse just disappeared after that. And then when we went down, the security was there and another witness was there. They expected us to, you know, act up.
Yeah. And man, glory to God that you kept your composure
Yeah.
and
Yeah.
you
But do you have to? I
But-
mean,
but
like,
did-
you know
did
what I
you-
mean? Like,
yeah.
let's be for real. If you are in that situation, that's hard to do within itself. And to put that, especially on a black person, because you know how people will label a black person who gets angry or whatever
Yes.
the case might be. The fact that we're expected to hold our composure because or out of fear of how someone will view us or how someone will portray us just adds a whole nother layer to the situation.
Yeah. I figured it was a trick, and I understood it was chess, not checkers. You know, I really seen that it was definitely a trick because the way the smirks and the smiles and the looks and the body language, I was able to read all that. The let's go type of energy. They didn't. I had to ask for a wheelchair. I'm like, could I at least get a wheelchair? And then I was expecting them to get the wheelchair and bring it to the room. They didn't bring it to the room. They brought it to the nurse's station so everybody else around could see. And that's what happened with my wife made that cry.
Wow.
And, I'm like, don't let them see you like this, baby. Let's go. They don't
So-
want us here. We ain't going to be here.
I want to back it up a little bit. You guys said that you was doing a short road trip. Like, at what moment do you realize, like, I need to go to the hospital? Did your water break at that time? And were you trying to get back to your home hospital?
Yeah, we were trying to get back to our home hospital. We was on the way home. But it's just I'm like, no, we have to stop now. We have to go to the hospital now because my contractions had been all day, right? It had started earlier in the day. And I'm like, I don't want to rush to the hospital. I just want to wait till they're about 10 minutes apart, 10 minutes apart. So when they got to the 15-minute mark, I'm like, let's go. Let's head there.
Yeah.
Now, how
We
close
don't
were
have
you?
time to go home. We
How
don't
close
have time
were?
to go.
I'm sorry. How close were you on your due date?
2 weeks before 40 weeks.
Oh,
That was
wow.
38 weeks.
Okay.
Okay. So Leon, you said they don't want us here. Let's go. I read it was a matter of 8 minutes when you had your baby girl in the car. So you all get in
Yes.
the car. Take us through what's happening. Where are you headed? And then at what moment do you pull over and you realize like
That-
we got to get this baby,
Yeah.
like the baby is coming out now?
Yeah. So we was heading to the nearest hospital, which is community hospital. Um, and got on the expressway. As soon as I got on the expressway, my wife like, "Babe, help me pull my pants down. I have to push."
Wow.
I'm like,
And
"Wait,
you're
baby,
on
just
the
wait till we get to the
expressway.
hospital." Like, yeah, just wait. I'm like, "Wait, babe." She's like, "No, I can't wait." I help her pull her pants down. As I help her pull her pants down, I see my baby's head.
Wow.
I see my baby's head.
Man.
And at that moment, I called 911, and there wasn't no help either. I literally, I said, my wife is about to have a baby. I see her head. What should I do? He's like, pull over and wait for the ambulance. I'm like, I can't wait for the ambulance. My wife is about to have my child. And I was scared to pull over anyway to go. The ambulance come and they take us back to the house.
Y'all wrapped around
Yeah.
y'all and Alina, and we are so happy that she is there with y'all in your arms right now, a beautiful baby girl. We are live and so many people are just sending love to you, saying God bless you all, and talking about how unacceptable this was. Now, before we get to how often this is happening to Black mothers and bring Yamel into this conversation, Cannon, I do want to ask you, the moment that you got this phone call and you heard this case and what was going on, how did it affect you? I want to hear from a legal perspective and just as a Black man.
I mean, it starts with being a Black man. I mean, I'm an attorney, but I'm a Black man first. Uh, I'm a human being first. And I mean, rage. You want to know the truth? Rage. That's. I'm furious. I'm furious about this. These people didn't deserve this. Look at this family, how beautiful this family is, and you tell me if it can happen to a beautiful family like this, people. I mean, it can happen to anybody. And from a legal standpoint, the first thing you do is you go into protection mode. I don't want any more assaults and insults to be pointed at this family. I want the Wells family to be able to enjoy what miracle is sitting in their arms. And even now, we feel like the hospital administration and the mechanisms that are in place by that hospital are doing violence to them.
Yeah.
They're circling the wagons, and I just don't know why that's acceptable. It's not to me.
Man, I'm so blown away. I have two children of my own, and just imagine going through this. I'm lost of words. I can't believe the fact that someone in this much pain. It's not like you walked in, you had a scheduled C-section. I mean, you are literally in labor. And at what point do you guys really just stand up? I mean, I appreciate you all being here, getting this message out to other mothers. But you think about the fear that if expecting mothers have going into a hospital, what would you advise young parents or even just parents who've walked through this walk before that are headed into a hospital? What do you advise to them? What do you say to them during this process?
Trust God. Trust God. Trust your body. Trust yourself. Know that you deserve respect. You deserve to be treated well. And, just be strong, because what we face has been a ongoing thing for years. And we just have to, and it's like we're forced to be resilient. We're forced to be strong. And I know we hear it all the time, like, just be strong. Like, it's okay, brush it off. It's no big deal. But it is a big deal. We deserve to be protected.
Yeah. At all times. Yamel, I want to bring you into this conversation, and your level of expertise. Not only did you speak to and have an emotional reaction to the video, right? So speak to that, but then also speak to how often are we seeing cases like this?
Yeah, very emotional. And first of all, I just want to extend to Mercedes so much apology on behalf of the entire birth community. There's so many fellow birth workers that we work every day to advocate for this not to happen. And I hope that I know that you recognize that you are not deserving of this. And the birth space is so sacred where your voice should have mattered. You saying to a nurse, I'm about to push, being 3 centimeters doesn't matter. You said, I need to push, right? I'm in pain, and that should have been addressed. Back to your question, Deanne. So how often does it happen? I think it happens extremely often. The difference now is that we have these little computers in our hand and we can document it.
Right.
So for many of us, probably for you, maybe you've never seen that. Unfortunately, we have those of us that work in the birth community. There's midwives that their life's work is making sure that we're amplifying the voices of Black and brown women and trying to bridge that gap, trying to ensure that we create safe spaces for birthing people, specifically Black and brown birthing people.
Yeah, and for those who are listening to this, whether it be live or a little bit later, putting into perspective, because y'all know I keep it real. Everybody always gotta be like, this not true. Like, why are you bringing attention to this? Let's speak on facts. So in 2023, the CDC reported the maternal death rate decreased for white, Hispanic, and Asian women, but it increased for Black women. And what is the why behind that? Why are we constantly seeing this increase in Black women dying when it comes to their maternal health?
Many things. Systemic racism. Let's start there. Unconscious bias.
Yeah.
I'm sure that even without being in that space where Mercedes was, there's this Dr. Sims, which a lot of us in the birth community don't even like to talk about, but we need to highlight this. So in the 1800s, he's known as like the father of gynecology. And it's because, of course, he did a lot of surgeries and experimented, but what did he experiment on? He experimented on Black slaves, women. Wow. And he did so without anesthesia. So what do people think now, right, that they're still carrying that unconscious bias around? Well, Black women have a higher pain threshold.
Yep.
And we're seeing that still today. There was a study in 2016, I believe, where they surveyed medical residents. So
I have that
students,
right here. Yep. First and second year medical students. Yep.
And they felt that Black women specifically had a higher pain threshold. What do we know in the medical field? We know that it takes about over a decade for what we learn to reach the bedside. Well, 2016, we haven't hit a decade yet, right? Wow. We're in 2025. So there are still people on the floor that think, oh, well, she has a higher pain threshold. She's not really in active labor, right? And then we're going by the numbers, and we should, like, as I took an oath as a nurse, we are to listen to our patients first. Sure, I'm watching a monitor, I'm looking at the facts, I'm looking at the information in front of me, but if my patient is telling me I am in excruciating pain and I'm about to have this baby, you need to listen to your patient. And if you can't do that, maybe this is not the profession for you.
Where does your moral ethics come into play here?
Where does it? That is a very good question. Where does it come into play?
Right.
I say this all the time, and I've even said it to my team as doulas. You know, we are protecting such a sacred space, right? Both as medical professionals, as birth workers, even myself as a lactation consultant. If I walk into a space with any type of bias, if I'm already walking into serving a client and I'm assessing things as their socioeconomic status or looking at different things that has nothing to do with their care and not being able to provide holistic care, not being able to provide care without any bias or without any racism.
Yeah.
You shouldn't be in this work.
Mercedes, did
So
you
hard.
feel like you experienced that unconscious bias in that moment when you were there with those nurses?
Absolutely. I felt dismissed, ignored. They had no regard for what I was suffering from. Like it was, I couldn't believe it.
Just looking at the video, I'm sure you drew attention from either other patients or other employees there at the hospital. And I'm sure, Mercedes, you probably don't recall, but Leon, was anybody else willing to help out or, you know, coming to you all's aid?
Not a soul.
Not a
And
soul?
that was a problem because when my wife let out that cry in front of the nurses station,
Right.
where all the nurses are at, nobody said, you know what, let's just check. You know, let's just give her a little bit more time. Nobody said anything. And that was a problem. Like, if anything, they was assisting a nurse that discharged us. The two, you know, how many times have you seen two nurses walk somebody down? You know, those two nurses were there. You know, we'll take her down. You know, they involved themselves in something that they should have helped rather than being involved in trying to take us down.
We have so many people in our comments right now, not only with the well wishes, but also we have someone who says this is why this happens so much amongst Black women and childbirth. But then we also have someone that says, I guarantee you there are much more undocumented incidents of this than there are documented. And we're here today, not even only because of a video, right? But that video is playing a large part in opening this conversation, right? And having conversations like this. At what moment did you all feel the need to record? And who did the recording?
My mother.
Yeah.
My mother,
Always about us.
she was like, she couldn't believe how her daughter was being treated. And she said the Holy Spirit told her, pull that phone out and record her baby.
Yeah.
And she was like, I didn't take the camera off of you because the Holy Spirit said, don't do it. Wow. Record my baby. Show the world what they're doing to my child.
And she is already.
Yeah. She is a nurse.
Your mom?
Wow.
Yes.
Oh, she must have been disgusted.
Oh.
She was very disgusted.
And I think my hat's off to you all for staying calm as much as you could. And this story not being flipped around to something completely different. Because according to the video, Leon, you're not a small dude, my guy.
By far.
I mean, and I'm a smaller frame guy, and I probably would have been turning over hospital beds.
Yeah.
And this would have been a whole different outcome.
Yeah. And he said at heart, he's a protector.
Yeah.
Right?
Yeah.
And Cannon, how crucial is this video when it comes to what's next for you all?
No, you've got your finger on the pulse. I mean, the reality of it is that it is imperative at this juncture that we're able to prove what happens to us. We are dismissed so frequently that if we don't have video, we are left to deal with that denial. And your commenter is dead on. There are multiple instances that are happening, many more instances that are happening that we don't know about simply because they've not been documented. The fact that their mother had the wherewithal to document what was transpiring is amazing, but it's critical and crucial to the fact that we're here where we are today. They'd be denying that this happened if it weren't for the video.
Yeah.
Right.
Yeah.
Before we are going to take a quick break, but before we do, because I want to talk about what's next. How do we get better? How do we avoid another situation happening like this? I do want to say we do have a statement from the hospital, and it says the health and safety of our patients is always our top priority. We have launched an internal investigation into the alleged incident due to patient privacy laws and our own policies pertaining to internal investigations. We are unable to comment any further at this time. So we'll take a quick break and we'll be right back. All right, welcome back, everybody. If you are just now joining us on Rooted in Progress, we are discussing protecting Black maternal health, protecting Black women, Black mothers, Black and brown mothers. We are joined by Mercedes and Leon Wells, who just went through an awful incident, discharged from a hospital while in active labor, ended up having a baby. Beautiful baby girl on the side of the road. Their attorney, Cannon Lambert, thank you so much for joining us. Local registered nurse and doula, Yamel Belen. We appreciate your insight. We want to talk about what's next and where do we go from here? Mercedes, Leon, Cannon, if you want to chime in on this as well. What are you all doing from here on out?
So with us in the situation, it need to be a change in policies and procedures. I mean, we're not going to give up until change. We're gonna fight this to the moon. You know, it need to be a change. It's not even for the Black community. It's for the human race. Like, this should not have been done. You know, where's your heart? Where's your empathy at?
Yeah.
You know, like, where's your concern? Like the nurse said, I mean, how could you be in this field if you don't have a heart? Mm-hmm. You know, and that's the thing. Like, you seeing my wife cry, you seeing this situation, you see the pain that she has, and you still turn her away.
Yeah. And
it's like not one person that saw and that situation had a voice to say anything. Okay. And that wasn't right. And we need a change. Yeah. We need a big change. This should never been. We want a regular life. This is not what we want for our child and my wife and family. We want to go back to our regular life, you know.
And we want Black women to be treated like they are human and like they matter.
Yeah,
that's what we want.
Yamel, is there anything that they could have done different?
As in the hospital?
As in the hospital, as in...
Well, hell yeah. Well,
a lot of things.
They could have did a lot. A lot of
things. Even if there, let's just say that there was a policy, because yes, there are admission policies, right? And I don't know that hospital's policy, but even if there was said policy that is like, well, we have to discharge if the labor is not at this point.
I'm sorry. That was, I mean, that's the obvious question. The hospital could have done a million things different. Okay. What I'm saying is there anything that Mercedes and Leon could have done different?
I don't think that I wouldn't feel comfortable turning the table towards them. Yeah. I think they did everything that they could have done. And I totally understand Leon's perspective where it's like, I don't feel welcome. You know, like that's one thing about our community. We are very in tune with how we feel 100%. In spaces. So if I don't feel comfortable somewhere, I'm not going to be staying there.
In a department
I don't
store
feel safe. He acted with his protective instincts. Yeah. However, to people that are listening and probably stepping into their birth space, because I don't want as someone that works in the birth field, everybody walking around and walking into their birth with so much fear, right? Watching what happened to Mercedes. I think a lot of education which Mercedes already had as a seasoned mom, right? Yeah. She knew that she was in active labor. Every hospital has a patient care advocate that is not on the floor. That is someone that you can request and say, no, I want that person to come to the room before I'm discharged. And if you're discharging me, I want you to document why you're discharging me right now. You're saying that I'm not in active labor. Okay, I want you to document that right now, and I'm going to wait for you to do that. That kind of puts the accountability on them, because now they have to write that I'm discharging Terrence because I don't feel that Terrence is in pain. And that is now documented.
That's crazy.
I don't think that in their specific case, there, like she said it. She said she said so many things. My water broke, which is a clear indicator for someone in the birth space that your labor could be very close. Not only that, it was not her first baby. So to me, as someone that's seasoned, that labor is shorter when it's not your first baby. That should have been a light bulb right away. Like, let me recheck her. Let me just see. Right.
The biggest light bulb that we kind of keep on going over a little bit, and it's slipped my mind, is that the last time she checked it, which is probably 10 minutes before discharge, she said she felt baby's head. That was the biggest thing. She felt baby's head. So I'm like, so what do you mean you feel baby's head? When is baby gonna be here? Today, tomorrow? I don't know. Maybe like an hour, 2 hours. When do you think baby will be here?
Yeah.
I'm like, she's like, I don't know. But might be today, might be tomorrow, might be next week.
Okay, now I'm no mom yet, but if you feel a baby's head from your expertise, what does that indicate, and how long can I guess the baby head just be there? I don't know. I haven't had a baby yet. Like, can the baby's head just be chilling for like a long time?
I don't know the context of. Did the nurse say that, Leon, or Mercedes said that?
The
nurse said, I felt the baby's head.
I feel the baby's head, but you're still 3 centimeters. I'm like, impossible. I don't even feel your hand.
Get out of here.
I'm like, the baby's coming, ma'am.
And let's explain to everyone about centimeters. That is very much. So when you have a more holistic provider, such as a lot of midwives, they don't even do vaginal exams because they feel that it can be interpreted like, right, I can do a vaginal exam and then my partner goes after me and their vaginal exam could be totally different. They could feel that it's 5 centimeters. So it's very much on the person that's doing the exam. But nonetheless, we know in the birth world that you can go from 3 to 10 in a minute. Wow. It happens. Right. Not every birth is textbook, right? Yeah. We're all individuals. So yes, I feel that at the minimum, what could have been done is for her to be heard, right? What she's saying, she knows her body, and let's just keep her here for a little bit longer and see what happens. You know, we're just going to put you in a room, keep you comfortable, which is the bare minimum of human decency. Let's keep you comfortable. Let me give you some water. That costs nothing. Let's be honest.
Mercedes, you said that the nurse told you she felt the baby's head, but you said that you didn't feel her hand. Yes. So did she do a check?
Her check. I was probably dilated so much that I couldn't just feel her hand. Yeah, and that's what I was trying to tell her. I'm like, I know that this baby is coming. I cannot feel your hand.
So she's actually possibly touching the baby's head.
She said that
which is what they said.
She said, I feel the baby's head.
And then, for her to send you home and tell you it could be next week.
Like that's
he didn't want us there.
Yeah,
and that's what
what it boils down to is that they even though they was at work, we ain't apply for the job. Y'all did. Like, you at work, literally supposed to be doing your job.
Right.
We didn't force you to be there. Like, you went to work and clocked in, and decided to show up to work today. And I when it comes to there's no way to fix this. It has happened. Thank God baby and mom are okay. 100%. Physically, because and I can only imagine where you all are mentally. So how do you all plan to even protect your mental health, the mental health of your other kids, the mental health of Alina, and the mental health of yourselves?
Counseling. Yeah, we're seeking that now. And we know it's important because we know what we feel, we know what we've been through. So, yeah.
I'm a big advocate of counseling, currently in therapy, and so I think that definitely helps. And I know you can never put a number on fixing this situation. Cannon, do you all plan on filing a lawsuit against the hospital and seeking anything in return?
So I want you to know you are looking at heroes. You are looking at people who truly, truly are heroes. Not only are they finding a way to navigate through this for themselves, but they are taking on the burden of trying to be the voice for a whole community. Yeah. And, I'll be honest with you, a lot of people don't have that in them. And I'm so grateful to be a part of what they're doing. and that their direction, their interest is right now to focus on whether or not we can identify the policies that allow this to happen and have them changed. We want a conversation, not with the lawyers of the hospital and all of that, but with the administration so that we can determine how it is that they would allow something like this to occur. And I want to be clear about something. In this conversation, we've talked a lot about various things, but be clear that Mercedes had no choice in this matter. Leon had no choice in this matter. They were removed from this hospital. It wasn't that they had an opportunity to make a decision. That decision was made for them. There's video that has not been disseminated largely through the general media, but you'll see Mercedes was rolled out of the hospital before Leon was even given an opportunity to get the car and warm it up.
Wow.
They wanted them out, and they wanted them out quickly. It makes no sense to us. It is hard to believe, but it is recorded on video. What we're going to do is we're going to insist that they do something to change what would allow this to happen. And if they make us file suit, that will come. The bottom line, though, is that this family has decided that they want to give them the opportunity first to have a conversation. And I respect them for that.
Wow.
Amazing.
I do too. I'd like to think if I was in this position, this would be the Deanne King Hospital. Okay? Like, my God. So that says so much about who you all are as people. And as humans, because it takes a lot to go through something like that. And all you are asking for is a conversation on how we got here and how is this allowed. So that, and I like, and you all can chime in, Mercedes and Leon, to make sure this doesn't happen to another person. Is that correct?
Yes.
This is the reason that we're, taking on the burden of trying to get the word out and making it our priority to push for a change.
Naya Mai in our comments right now said, thank y'all for being the face of this. I think you all are true heroes. And I think that's the case for a lot of people. I view it too. And I'm sure internally you might ask God, why me? But I know he never put something on us that we can't bear. And he chose y'all. And I think because of you all, that won't happen to Deanne.
Right.
That won't happen to another person.
Don't forget the mother-in-law for videotaping.
Yes.
Because you can imagine several years ago, before cell phone videos and social media, how many women went in and this happened too. So, my question is, right before we went to break, we read off the statement from the administration there, and you did say they are somewhat being cooperative. Do we know the status of these nurses at this point?
So that's one of the other issues that I have. Yeah. Instead of making a statement, fire that woman. Fire that woman. Don't give us a statement that says that because of our internal policies, if you read the statement, be very clear about what that statement says. It says that because of HIPAA, which is designed to protect the Wells family, not the hospital, and because of our internal policies or internal practices, we can't comment further.
Oh, Mercedes.
That is circling the wagons. That is designed to pacify the public. That is not designed to address the issue. How can you have it? How can you have an investigation and you don't speak to the family who was the subject of this misconduct?
My God. Mercedes, Leon, I know this is so difficult. I see you all getting emotional right now. Do you mind sharing what's going through your mind?
Anger. Why? But we are believers, and we know God gives us the hardest battles to the strongest soldiers. I'm sorry, but this whole thing, we want to change. Like we want to change for our community. This is 2025 in America. We should not be going through what we went through. We should not be going through this. Not this for, black people. Like have a heart. Yeah. Like we are kind people. Like for real. People that know us know our heart. Like we are givers. we give a lot away to people. We help a lot of people. People that know us know what we do for people. Like, we help a lot of people.
So many of us have been mistreated, women, Black women. And it just happened to a woman before me in Texas.
Yeah.
And she was screaming
Yeah.
in pain.
Yeah. That video just recently was released as well.
It was right before me.
Yeah.
And I was watching it in the hospital.
Wow.
And I did not think or fathom that it was actually going to happen to me. It was insane to even think that they could do that to her.
Yeah.
Or let alone anyone.
Mm.
And I'm so upset. Like, this has to stop.
It does. And when we talk about policy, so when we look at options, right, as far as having a baby, you can go to a hospital, have a baby, you can have a midwife, you can have a doula. Can you talk through the options that women have when it comes? Now, in this case, again, yours is an emergency situation. Yeah. So as sometimes you don't have an option and the hospital is your only option, right?
Yeah.
But there are also other avenues for women to seek when it comes to having a baby. Can you speak to that, Yamel?
So for me, it's funny enough for me, I no longer felt safe in a hospital setting. So I went from a hospital birther to a home birther.
Wow.
And I was already a nurse. And I didn't feel safe. I wanted a different experience for myself, for my family, for my kids to witness. So you can do a hospital setting, traditional hospital setting. You can do a home birth setting. You can also do a birth center setting. Now, a lot of hospitals now, especially locally, Tampa has, which we love, Tampa General, which is equipped with midwives. And their style is more holistic. Their style is more that someone like Mercedes, and I've sat on many boards where we are trying to improve vaginal birth outcomes. That's one of the things that we talk about, being able to provide culturally competent care and speaking to nurses and educate. That would be one of the first things that this hospital needs to do, is some culturally competent care to discuss with the staff, what would you do in these cases? And what are your thoughts about Black and brown birthing people? That's a first step that they need to take.
Wow.
Yeah. Guys, we're going to take a break. We'll be right back.
All right, we are coming back into the Rooted in Progress Stream Center live right now with Mercedes and Leon Wells, two beautiful parents in their beautiful new bundle of joy. Alina, their attorney, Cannon Lambert. We appreciate you all spending this time with us. Yamel Belen, a local registered nurse, as well as a doula, having this conversation about an unfortunate situation, but ultimately at the hands of disparities in our healthcare system. Mercedes and Leon, I know this is your fourth baby, right? Can we speak to the impact? Does this change your idea of potentially even having other kids, or does it even change your idea of how you take care of your current children, sending them to doctors, taking them to doctor's appointments, or what happens if your other child gets hurt? Has this changed your perception at all?
We've become more protective at this point. You know, we want to protect our children.
Yeah.
So it is scary thinking about bringing another life after this into the world, as we do want to. We're considering maybe not doing it again.
Wow.
Yeah. We just don't know if that's a good decision to make right now. We want this to be dealt with.
Yeah.
Ultimately, 100% before we really truly consider that.
Yeah.
What would you, even if you were to or want to have more children, would you consider going the Yamel route, the doula, midwife route?
Absolutely.
Yeah.
Yes. 100%.
Yeah. I could only imagine. But like we said, we could go that route.
Yeah.
But an emergency, like in your case, can always happen.
Yeah.
And so
because that doula or the midwife is not going to be at every single step on the interstate coming back from a short trip. So
that is definitely the case. Cannon, before we wrap up, a few minutes left here, any message that you want to get out there to potentially any other person, any other family going through a situation like this before, or any other words that you'd like to say on behalf of the Wells family?
Yeah, I would just say this. I think that we have to remind ourselves to be advocates for ourselves. We have to be strong advocates for ourselves. And that means, like what your prior guest has said, you've got to speak up and don't be hesitant or, don't be apologetic for speaking up. Protect each other and protect yourself. The institutions that are in place right now don't always do honor to us, and we have to make sure that we're aware of that and we do all we can to push back on that.
Absolutely.
Yeah.
Yamel, do you have any final words for folks out there, maybe expecting mothers who are listening to this conversation?
I would say that there are a lot of us in the community, maybe even in Mercedes' community, that are doing the work. Even here in Tampa, we have organizations such as Mama Care Rising, which provide loads of education, even complimentary or free doula services for people to improve outcomes and to not have things like this. Get involved with different events in the community that are to amplify these voices. We celebrate Black Breastfeeding Week every year in my organization, and we have a very low turnout. And I'm like, why? Yeah. This is so important to me. Black Maternal Health Week, like we need to celebrate those things. And then also, I think there's still the disparity in our communities with highlighting, Black pregnant people. We don't see the imagery. Even me in lactation, I don't have enough Black breastfeeding imagery. So we need to fill those gaps as well so that people are seen, and then having these complicated conversations, not waiting for something like what has happened to Mercedes, because like we said in the beginning, it is happening. It's just not always being documented.
And what I'll say also, and this isn't even to our own harm, but to people who are listening and are unaware, never heard of Rooted in Progress, and never even heard of myself, right? We actually, we do a Black History Month program every year. And a big part of our program, y'all, and even to Mercedes, Leon, and Cannon, a big part of our program focused on the disparities that Black women face with maternal health care. I do stories. I have a segment called For the Culture where I do talk about this. I've done so many packages with doulas and midwives and talking. That's how I know the fact that I've been reporting on this for 8 years, nothing has changed. I haven't said a different statistic when I do a story like this. Nothing has changed. And so make sure, and that's why I'm even so appreciative to have you all sharing your story, because sometimes it's even hard for us as journalists to even share stories like this because people are afraid to speak up. Yeah. And people are afraid to share their stories. And that's why even when y'all got on, I'm like, I'm so grateful to meet you all. I hate that it's under these circumstances, but I thank God that you all have enough strength and you have enough faith to continue sharing your story so that people know that this is an issue.
Yeah. So proud of you, Mercedes. Follow Mama 5 here, and I send you so many hugs.
Yes. Thank you, guys.
Yeah, guys, we want to thank you for joining us and just, I know we reached out to you just recently and making the time to join us this morning. And I'm just proud and honored, along with Deanne and our team, to help get this message out.
Yes. And give a shout out to Alina, who's been like day one girly during this whole show. And you all said before we went on, her name means bright shining star. I cannot wait to see where Alina is in years and your other babies. We send all of our love. If you don't mind, stay on after we close out this show, because I do want to ask y'all a couple of questions personally outside of this, if y'all don't mind. Thank you again. Yamel, thank you so much for hanging with us and talking about this important conversation. Y'all, we're on Rooted in Progress. We are live every Thursday. I know we brought a conversation on Friday, but it was important for us to hop on.
It is Friday, isn't
it? It is Friday,
I know,
praise
right?
God. Okay.
But you know how we do it.
I will see y'all behind.
You just got to be
Monday.
ready for Rooted in Progress at any day of the week. So
yes, 9:30. This you can always follow Rooted in Progress on YouTube, Spotify, Apple Podcasts. You can also follow us on Instagram and on Facebook. Y'all, please take care of yourselves, no matter what you look like.
Yeah.
Always advocate for yourself, no matter what you look like. Black, brown, white, yellow, red, purple, whoever you choose to be, because it's 2025. You could wake up and you want to be an animal. Okay, praise the Lord. Take care of yourself. All right.
Not an animal. Hey, y'all, let's keep this family in prayer. Keep this family in prayer, and everyone stay rooted. Thank you all so much.